Well, for people that don't know and haven't heard you before, can you give a little bit about your background? And then let's talk about the foundation, how it came to be.
Yeah, absolutely. Well, I'm a board certified internal medicine and gastroenterology physician and practiced very conventional medicine with two-thirds of my patients. But in the early 1980s, I encountered a patient that I didn't know the first thing about diagnosing or treating, even though I was, 8 years into my medical education. So it came as a shock that a psychiatrist was able to cure that patient. I had no idea that such a thing was possible, that you could alleviate a serious physical condition just by talking to somebody. And these are patients that don't have any obvious organ disease or structural abnormality or injury to cause their condition. You do the diagnostic tests that we're all trained to do as physicians, and you don't find any explanation for why they're having chronic pain or illness. And it turns out that in those patients, the symptoms are very real, but they're generated by the brain, much as phantom limb pain is generated by the brain. Somebody gets pain in the place where they have an amputation. There's no limb there anymore, but it still feels like it hurts there. And that's generated by the brain as well. So these patients are a great source of mystery and frustration for the healthcare system. Most physicians are not formally trained in how to diagnose or treat them. But it turns out if you know what to look for, you can have outcomes every bit as successful as you can with anybody else. A group of us from around the country, everywhere from Boston to Los Angeles and many places in between, found that we had all learned how to do this. And we came from different backgrounds. We had all different specialties, both medical and mental health. And we came together to form what we call the Psychophysiologic Disorders Association. The psychophysiologic word is just a combination of psychology and physiology. It's the mind and the body in collaboration with each other, if you will. And we try to educate healthcare professionals and the public about this, because people who go to the doctor and are not getting diagnosed, they wander the system for years, sometimes for decades. My personal longest illness patient was symptomatic for 79 years. And even she was successfully treated once the issue was uncovered and successfully dealt with. So there's hope for everybody with this. But
Quick question here. Do people present this way from, were they healthy one day and then all of a sudden they have this problem? Or does this only seem to come after they've had certain other problems that somehow trigger it?
A lot of the time it just comes out of the blue. My very first patient was doing fine. She wasn't under any particular stress that she was aware of. She was happily married. She had 2 kids. She was working half-time in a bank, which was a job that she enjoyed. And all of a sudden, in her case, she started having 1 bowel movement per month. And even taking 4 different laxatives at double the usual doses didn't make any difference. And she went to the university hospital in her local community, and they found absolutely nothing wrong with her. They sent her to us at UCLA, where we did specialized testing on the electrical and mechanical properties of the bowel. And my department chair and I were absolutely convinced that this test was going to be abnormal, because there was no other explanation that was possible as far as we were concerned. But we were wrong. That test was normal. And I was doing her exit interview and stumbled on the fact that she'd been sexually abused as a girl. Unfortunately, not just once or twice, but hundreds of times. I had no idea if that could be connected to somebody being physically ill 25 years later, but it turned out there was a very strong connection. The psychiatrist that I consulted was very well aware of this and cured the patient in less than 3 months of weekly counseling sessions. So yeah, this can come completely out of the blue for people, or it can come on gradually. The symptoms can, in some cases, move from place to place. Other times, the symptoms are quite variable in how severe they are. Other people, there's more than one symptom. My personal record patient had 27 different symptoms that he personally was suffering from. He came to me with a printout from the internet, and he circled all these things that he personally had. Even that patient, all of them went away with the correct diagnosis and treatment in about 30 days. So if we uncover the stress, and it's always a stress that's producing changes in the circuits of the brain that then in turn produce the symptoms in the body. And if you trace it back to the causative stress, like the sexual abuse in the first patient that I mentioned. You can help people cope with that. And when you do, they start to get better. Now, sometimes it takes, months of counseling or even years of counseling to get the outcome that we want for patients. But even those patients, they know they're on the right track. They can see that they're making progress, and it's a tremendous source of hope for them.